Finding a genuinely qualified physiotherapist who uses an evidence-based approach and is accessible from where you live in Malaysia has historically required either a specialist referral or guesswork. Let me give you a practical, structured framework for making this decision efficiently. The first thing to verify is registration. In Malaysia, physiotherapists are regulated under the Allied Health Professions Act 2016, and practicing physiotherapists must be registered with the Allied Health Professions Council of Malaysia. A recognized degree in physiotherapy from an accredited Malaysian or international institution is the baseline academic requirement. Membership in the Malaysian Physiotherapy Association is the professional standard. You can verify a physiotherapist's registration through the MPA website before booking. It takes under a minute and is worth doing before committing to a provider. The second factor is specialization and experience. Physiotherapy is a broad profession, and different physiotherapists have meaningfully different expertise in different areas. A physiotherapist with postgraduate training in sports medicine will deliver better outcomes for a returning competitive athlete than a generalist without that background, even if both hold identical base qualifications. A women's health physiotherapist is the right specialist for postnatal conditions and pelvic floor disorders, not a sports physiotherapist without that training. When booking, ask specifically, what conditions do you most commonly treat, and do you have experience with my specific presentation? If the answer is vague or generic, consider whether the clinic's primary focus matches your clinical need. The third factor is treatment approach. An evidence-based physiotherapy practice will have exercise prescription as a central component of treatment, not just hands-on passive modalities. The clearest way to test this before committing, ask what a typical treatment program looks like, and specifically whether it includes a progressive home exercise program. If the answer is that treatment is primarily hands-on, with no home program component, the approach is not aligned with the evidence base for most musculoskeletal conditions. Beyond qualifications and specialization, the quality of your first appointment experience is the most reliable early indicator of clinical quality available. A thorough initial assessment covers mechanism of onset, aggravating and easing factors, functional limitations, previous treatments, and your specific goals. And that history alone should take 15 minutes. A movement assessment demonstrates specifically where your restrictions and impairments are, making the subsequent treatment targeted to those findings rather than generic. The treatment plan should be explained to you. What structure is being treated, why, what the home program involves, and what progress to expect on what timeline. A physiotherapist who cannot explain the rationale for their treatment choices in plain language may not have a clear clinical rationale to communicate. The fourth factor is practical accessibility. Attendance consistency is a stronger predictor of good rehabilitation outcomes than almost any other variable. The best physiotherapist in Malaysia, who is 2 hours from your home and fully booked for weeks, will produce inferior outcomes to a competent local physiotherapist you can see consistently without scheduling barriers. For patients who cannot reliably attend a clinic due to mobility, transport, or scheduling constraints, home physiotherapy is a clinically effective and evidence-supported alternative for most musculoskeletal presentations. In Malaysia, PhysioNear's directory is one of the most comprehensive searchable resources for finding qualified physiotherapists by state and city. Coverage extends from major urban centres, Kuala Lumpur, Petaling Jaya, Shah Alam, Penang, Johor Bahru, Ipoh, to district-level listings across all 13 states. Each listing includes the clinic services, the physiotherapist's credentials, and areas of specialization, and the conditions most commonly managed. Listings are searchable by specialization area, sports physiotherapy, women's health, neurological, pediatric, and general musculoskeletal, so you can filter to practitioners with direct experience in your specific condition. For conditions with specific treatment pathway implications, the right specialist background makes a meaningful difference to both the speed and completeness of recovery. Search by your location or your condition type to generate a short list of qualified providers in minutes. The directory is in the link in the description. This is the most efficient starting point for finding physiotherapy near you in Malaysia.